Yeah, and then, after the monofocal lenses had really become very commonplace, we started to think more about cataract surgery as a true refractive surgical procedure. And, we would never as clinicians think about prescribing a pair of glasses for a patient that didn't correct for their astigmatism. Well, that's exactly what we were doing in cataract surgery with a single point distance vision with no astigmatism correction. And for those patients who had moderate to more severe ranges of astigmatism, those were patients who still, really required significant prescription to be able to see clearly.
We would see that a lot of patients, number one, they were happy they got rid of their cataract. And they would be happy if they didn't have astigmatism, especially that they saw really well at distance. But we always had some patients who could see, maybe they could see their dashboard better than others, and maybe it was pupil size, maybe it was the spherical aberration of the cornea, but there were patients who got a little bit more, not all of them. But we didn't really think a whole lot about that. We were just kind of happy for that. And today, I think we just have a bigger focus on, well, really, what are our lenses doing for patients at all distances? And that's kind of changed.
Yeah. You'd notice something as a clinician, which made it kind of fun, which is, I was trying to do this, and I actually was able to accomplish really great distance vision for this patient, but they're sitting in front of me and they can, read intermediate vision. At that time, there weren't cell phones that were at least of what we think about today as a cell phone.
But there were more desktops.
But there were desktops, exactly, and they could see their computer, and you'd sort of scratch your head and say, okay, what did I do differently with this? And it really caused us, I think, to really look at the kinds of innovations that eventually we'll talk a little bit more about. But, on the journey there, was the whole toricity story. It was very clear from the beginning that if you corrected a patient, if you corrected a patient's astigmatism properly, not only did they have super distance vision, but they were able to get some intermediate vision. And then the wheels started turning. What's next? Well, geez, if I could get rid of these damn reading glasses, that would really be a game changer for me. How come you guys don't come up with lenses that can also correct for the near vision? And that's when the expectations of our patients really soared and made us think, what are we really doing? Are we really doing enough for patients? And I think the other part of it that's important is that a lot of the things, and Rob can speak to this better than I, but the materials that have changed and the way in which we use those materials and can do things differently with them than we could back when we certainly were using a rigid, PMMA type of material.
And knowing that you're going to hit your target.
Yeah.
Right. That's been, I think, one of the biggest changes is having, over the years, our biometry's become better. We have intraoperative aberrometry now that can help us really hit the target. So,
nomograms are better.
Exactly. Everything's better. And I think that it really unlocks the ability to treat toricity.
Yeah, I think that's a really good point. I think there's lots of examples about how innovation, because I talked earlier about how we've constantly kind of raised the bar, kind of raised the expectation of how we should do this job of refractive surgery using IOLs. And I think there have been fundamental innovations in materials and mechanical designs that have enabled us to think more ambitiously about what we can do. The other theme of the conversation so far as we think about the journey from just monofocal correction to astigmatic correction to going for some level of reduced spectacle dependence is all of these elevated ambitions have been marked by meaningful improvements. It's really meaningful to go after astigmatism. It's really meaningful to reduce dependence on spectacles. And I think that's the way we have to think about how to drive innovation.